Hello and welcome to our presentation on the Ohio Occupational Therapy, Supervision and Delegation to Assistants and Aides. My name is Zachary Edgar and my company is called Therapy Comply. Therapy Comply is a membership-based compliance firm dedicated to physical, occupational, and speech therapy practices. Members can access our wide selection of guides and sample policies on federal and state law, along with our guides and updates on private payers. Members can also simply email us at any time with any compliance or billing questions or arrange a phone call. We also offer more comprehensive services like compliance and billing audits, custom policies and procedures, and credentialing. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. The OT must assume professional responsibility for the provision of all occupational therapy services, of which the following activities must not be wholly delegated, regardless of the setting in which the services are provided. This includes the interpretation of referrals or prescriptions for the occupational therapy services, interpretation and analysis for evaluation purposes, and the development, interpretation, and modification of the treatment plan and discharge plan. The supervising OT must consider the following when delegating to the OTA: the clinical complexity of the client, the competency of the occupational therapy assistant, the occupational therapy assistant's level of training in the treatment and intervention technique, and whether continual reassessment of the client's status is needed during treatment. The following factors must be considered by the supervising OT when determining the appropriate frequency, methods, and content of the supervision: complexity of the client needs, number and diversity of clients, skills of the occupational therapist and the occupational therapy assistant, type and number of practice settings, requirements of the practice setting, and any other regulatory administrative requirements. The OTA may contribute to and collaborate in the evaluation process by gathering data, administrating standardized tests and/or objective measurement tools, and reporting observations, the preparation, implementation, and documentation of the treatment plan and discharge plan, choosing the appropriate treatment interventions. The OTA may independently select the daily modality of choice according to the established intervention plan and document the progress and outcome summary. The OTA may respond to acute changes in the client's condition that warrant immediate action. The OTA may not evaluate independently or initiate treatment before the supervising OT performs an evaluation. Supervision of the OTA requires initial direction and periodic inspection of the service delivery and relevant in-service training. The OT need not be on site but must be available for consultation with the OTA at all times. Supervision requires an interactive process between the supervising OT and OTA. The interactive process must include, but is not limited to, review of the following: the client assessment, client reassessment, treatment plan, intervention, and discontinuation of the treatment plan. It is the responsibility of the OT and the OTA to establish evidence that the supervision occurred in accordance with the regulations. This evidence may include documentation in the client record, or it may exist as a separate document, such as a collaboration log. The supervising OT must provide supervision at least one time per week for all OTAs who are in their first year of practice, and the supervising OT must provide supervision at least one time per month for all OTAs beyond their first year of practice. Any documentation written by an OTA, student OT, or student OTA for the inclusion in the client's official record must be co-signed by the supervising OT. Occupational therapists must be designated OTL if the OTA does not hold the current NBCOT certification, or COTA/L if the OTA holds current NBCOT certification. As of now, Medicare requires that therapists in private practice or employed by a physician group be on site when an assistant is treating a patient. The 2025 proposed physician fee schedule will change that rule to general supervision so that therapists can be off-site when assistants are treating patients, though therapists will need to be available by phone. For states with more restrictive supervision levels, such as direct supervision, those therapy services are always furnished to the extent that is permitted under state law, and if it's required that you be on site by state law, you will still need to be on site when treating a Medicare patient. Most payers and state Medicaid programs defer to the state's physical or occupational therapy board rules for the supervision of assistance, but may require more frequent reassessments. TRICARE follows the Medicare rules and requires on-site supervision, and have yet to propose a change to that rule. Any person who is on the job trained and supports the delivery of occupational therapy services by personally assisting the OT, OTA, student OT, and/or student OTA while they're serving clients must do so concurrently with the same client. The primary function of unlicensed personnel is to perform designated routine tasks related to the operation and delivery of occupational therapy services. Such tasks may include routine department maintenance, transportation of clients, preparation or setting up the treatment equipment and work area, taking care of clients' personal needs during treatment, assisting in the construction of additive equipment and splints, clerical, secretarial, and administrative activities, and personally assisting the occupational therapy personnel while they are concurrently providing services to the same client. Occupational therapy personnel may delegate the following: performance of occupational therapy evaluative services, initiation, planning, adjustment, modification, or performance of occupational therapy services, or making occupational therapy entries directly in the client's official records. Unlicensed personnel must not act independently on behalf of occupational therapy personnel in any matter related to occupational therapy treatment. Unlicensed personnel may only perform specific tasks which are neither evaluative, task selective, nor recommending in nature. The occupational therapy personnel may delegate such tasks only after ensuring that the unlicensed personnel have been appropriately trained for the performance of these tasks. If the aide is with a client, then the supervisor must be concurrently providing services to that client. Aides should be identified as aides so not to be confused with any other providers. Medicare, TRICARE, and most Medicaid programs expressly state not to bill for the services of aides. Most private payers state that services must be performed by a licensed therapist or an assistant under their supervision. Do not bill for services provided by aides unless the payer guide expressly allows you to. I've never seen a payer allow billing for aide services and really would recommend never doing it. Thank you for watching, and please visit the website for a lot more comprehensive information on physical, occupational, and speech therapy compliance and billing. Please like and subscribe. We'll be adding many more videos soon.